So a common complaint that people seek a chiropractor for is because they're having neck pain or they're having headaches. Now what we need to understand about these conditions is that there's a correlation between our spine, our vertebrae, and our nervous system and our spinal cord. So the number one job of all of the bones of our back of these vertebrae is to protect our spinal cord. Its second job is for our motion and movement. So what happens in our life is that we have stress, whether it's physical stress, emotional stressors, or toxic stressors. But what happens with our body is that as it becomes stressed out, it becomes flexed. And my saying is that flexion is protection, extension is expression. So as for Danica here, if she's working longer hours, sitting at a desk, studying at school, using her cell phone to talk to her friends, her head position begins to go anterior. So as her head begins to shift off of midline, now the leverage and the biomechanics of her body have to change. And so as her head falls forward, it starts to not only mess up the biomechanics of her motion and movement, but it also begins to increase the pressure on her spinal cord. Now her neurology has to make a choice. Is she going to be in sympathetic fight or flight mode, or is she get to sit in parasympathetic rest and digest mode? So as her head pushes forward, her muscle tone is going to increase because she is becoming more sympathetic dominant into there. So that changes muscle tone, it changes our circulation. We get neck pain, we are stiff, we're rigid, we're compressed, we get headaches.